Dydrogesterone. Dydrogesterone, sold under the brand name Duphaston among others. Dydrogesterone has proven effective in a variety of conditions associated with progesterone deficiency. What's the role of progesterone? Progesterone plays an important role in your menstrual cycle and pregnancy. Progesterone creates a healthy uterine lining to support a fertilized egg, embryo and fetus. If progesterone levels are too low during pregnancy, it could cause complications such as bleeding or miscarriage. Dydrogesterone is a synthetic progesterone. Dydrogesterone now uses of dydrogesterone. How to use. It's used to treat menstrual disorder caused by lack of hormones in women. It's also used to help prevent miscarriages and abortions. The drug is mainly used to relieve pain and menstrual cramps. Dysmenorrhea. Dydrogesterone helps to regulate the healthy growth and normal shedding of the uterus lining. Therefore, it may be useful in the treatment of menstrual disorders such as absent, irregular, or painful menstrual periods, infertility, premenstrual syndrome, and endometriosis. Endometriosis is a disease in which tissue similar to the lining of the uterus grows outside the uterus. It can cause severe pain in the pelvis and make it harder to get pregnant. Indication and dosage. Oral, recurrent miscarriage. Adults, 10 mg bid until 12th week of pregnancy. Oral, infertility due to luteal insufficiency. Adults, 10 to 20 mg daily starting on the second half of menstrual cycle. Until the first day of next cycle, maintain treatment for at least 3 consecutive cycles. Luteal insufficiency is usually defined as an abnormally low progesterone level 3 weeks after the onset of menstruation, serum progesterone below 10 to 12 ml. Oral, dysmenorrhea. Adult, 10 to 20 mg daily from day 5 to 25 of menstrual cycle. Side effects of dydrogesterone: nausea, abdominal pain, vomiting, diarrhea, dry mouth, indigestion, rash, itching, hives, mood changes. Contraindications of Duphaston. Dydrogesterone may cause sensitization, which is an important contraindication to the use of this medicine. Other contraindications are cancer, whose development can be influenced by progesterone levels, bleeding in the genital tract of unclear cause,